What are you doing out here today? What's going on?
I'm out here in this kind of cold, blustery afternoon because there's a rally, Medicare for All, which I have believed in and fought for a number of years now. I'm especially excited now because it's gotten national attention. It's on another level at this point. I think a lot because of Bernie Sanders, has put it out. And what amazes me is that so many Americans believe in Medicare for all, even though the corporate friggin' media is so against Medicare for all. They're, filling the airwaves with lies, and still, in spite of all of that, there's still so much positive feeling about Medicare for all. People understand much more than they can be expected to, given the lack of information and the misinformation that's coming out. So this is an important time with the Democratic candidates, a number of them standing up for Medicare for all, and others pulling back in the corporate way against Medicare for all and pushing for a basically private insurance, and basically, shilling for the healthcare industry.
Thank you.
Shelly and I are new friends.
Oh, great.
We just met today, but I feel like we're going to be friends for life. It's one of those things you just know. Today's rally for Medicare for All is kicking off the annual Healthcare Now and Labor Campaign for a Single Payer Conference, bringing in hundreds of people across the country to Portland, Oregon, to talk about where we're at in the movement to win truly universal guaranteed health care and improve Medicare for all system. And so folks are rallying here today for the cause.
Right, and we also, like you say, we spoke about single payer. We constantly have people that's struggling, trying to get things done. No one should have to suffer, and no one should have to go without health care. So until this fight is over, you have to see
unequal health care.
Right, unequal health care. Unfortunately, I deal with that constantly until it's fixed, until it's done. You constantly see groups like this all over the country. So we're going to make sure they get it done. Okay?
Thank you. So why have you come out here today in the rain?
To support Medicare for all. We all need health care.
So what does the health care mean to you? What's different about it?
It means everybody can afford to be treated equally. No health disparities. Equal health treatment.
We are having a rally for Medicare for All. There's a national Medicare for All conference that is organized by Healthcare Now and Labor for Single Payer that's in a different city every year. People come from all over the country to attend. And this year, the rally is here in Portland, which is very exciting. And as part of that, a kickoff to it, some local folks organized a rally for Medicare for All.
Can you tell me how it's going to be paid for? That and what Medicare is, single payer is, are the two questions people are interested in knowing.
So why don't I start by describing what single payer is first?
Perfect.
Okay, so it's a system that has everybody
in, nobody out. Everybody in, nobody out. Thank you.
Well, that is actually what it is. It's a system that has everybody in and nobody out. It's a system, so like Medicare is today, the CMS, through the government, pays the claims to the doctors and other providers. And Medicare for All is creating a new system that where all those claims go through and are paid for in the same way. And the difference, though, is instead of just including people over 65 or who are legally disabled, we're including everybody. Many confuse it with current Medicare, and it is way better than current Medicare. Well, with current Medicare, you have to buy buy various supplements. You have to buy drug plans. There's no dental. There's no vision. There's no auditory. With Medicare for All, there are no all of those things are covered. There are no supplements to purchase, and there are no co-payments and no deductibles. So it's much more thorough insurance. So people who are already on Medicare are better off, and people who don't have Medicare, who are really struggling, are much better off. One of the things that's so great about it is that it pulls everybody together. Because what insurance companies try and do is they find elaborate ways to make sure that their plans have the healthiest people so that they can have the greatest profit. But Medicare for All doesn't allow that because everybody's in the same plan. The parts of Medicare that are truly public have less than a 2% overhead. Insurance companies average close to an 18% overhead. So what's happening? Every time you give an insurance company $100, they're taking $16 and doing something with it. Well, what are they doing with it? They're using it to deny claims and hire people to deny claims. They are using it to pay exorbitant salaries to their CEOs. If they're for-profit, they're paying stock dividends. And they are donating to political campaigns, and they're hiring lobbyists. And all of those things are designed to convince us that their plans that deny care and often cause people suffering and bankruptcy and sometimes even and frequently death are better than a government plan, which is already proven. The private parts of Medicare is already proven to be more efficient and cheaper. It's very easy to pay for because we're already spending more money than it takes to run the system. People are paying that money in the form of premiums, co-premiums, deductibles, co-payments, out of uncovered expenses, not having insurance at all, medical bankruptcies, losing their house, losing their house after their family member has already died. We are already paying for it. Now, 2 studies have been done to show how much money this would cost to implement the system. And the first study, both studies have their own political bias. The first studies was done by the Mercatus Institute, and they take money from the Koch brothers. And even so, when you looked at their numbers after they talked about how expensive it was, we were able to show that through their numbers, even though we think their numbers are biased, we could save $2 trillion over 10 years. And the Jane Sanders Institute hired another group in Massachusetts to do a study, and that study showed $3 trillion. So the number is somewhere in there. So it's definitely going to be cheaper than what we're spending now. The only difference is how are we spending it? And we're not spending it by going bankrupt or having to do GoFundMes when we're sick. We're spending it by paying the amount, and a reasonable amount that we can afford out of tax dollars and each month when we are healthy, and having it always be there for us when we really need it. And that's what insurance is supposed to do.
Can you tell me, is there a difference, or what is the difference between Elizabeth Warren's and Bernie's plan for single payer?
Well, they're both promoting the same bill right now that Bernie wrote. Jayapal has written a bill in the House that is also absolutely excellent, and that has 118 co-sponsors. That's Representative Pramila Jayapal. HR 1384 is the number, and that is our other excellent Medicare for All bill.
Medicare for all! When do we want it? Now! What do we want? Medicare for all! When do we want it? Now! What do we want? Medicare for all! Yeah,
live like across the corner, like block away. Yeah.
Oh, the other Wisconsin guy there.
Yeah.
Yeah. That's where I lived for 2 years until the snow got me.
Yeah. We need one of those for the campaign. Don't forget that. Care for all Oregon. I'm Bill Whitaker from Grande, and we brought a whole group of people over here today to be a part of this rally because we know that universal health care, Medicare for all, is what we need. And it's about time that people all across the state and all across the nation have their health care met, and so we really need Medicare for all in order to do that. We need to get the insurance companies and the profiteers out of the medical system and have a system that's really run by the people, for the people, and of the people.
Well, we're out here because the only thing that's going to change this system is going to be mass action by people all over this state, obviously all over the country, which is looking at the state, that's where it's going to happen. I'm a legislator. I've been working on this for a number of years. We will frame this issue in the legislature, but it's going to take the people to come out and vote for it to make it happen. And, Healthcare for All Oregon is doing such a great job of organizing people all over the state, and today bringing in national people to show what can happen when people join together, not only from different parts of Oregon, but from different parts of the country. And that's how action will happen. And I'm just so glad to see that Medicare for All, which just a few years ago, if you talked about it, people would say, what are you talking about? Now it's something people are talking about, and we're getting pushback on it, and that's actually a good sign.
What kind of pushback? What's your biggest resistance?
Oh, I would say that the biggest pushback is over the question of how do you pay for it, right? And those of us who are strongly behind Medicare for All believe that first of all, it needs to be paid for in a progressive way, right? So that the bottom line is that people will pay less under a Medicare for All program than they do today. Once you take in all the co-pays and the monthly premiums and the incredible prices we're paying for pharmaceuticals and services and unnecessary bureaucracy, there is just so much expense in the system that doesn't need to be there. So single payer will actually cause most Americans to be paying less than they currently are. Some people will pay more, but they'll be paying more because they can afford to pay more, and they need to help. I was just last week. I was in Europe. My wife's family is French, and her uncle is about 88 right now. He's 88, 89, somewhere there. An extremely conservative man. I mean, you might say politically reactionary, actually, really right-wing. But we talked about, our healthcare system here as opposed to there, and he just could not fathom the notion that people are going without health care, or they're going with such inadequate health care. There are some things that, people who have lived within a correct system just take for granted. He certainly does that. And it's such a change from here. Once we make this change, people will get used to this system, and it will become second nature because it's the way it has to be. My wife and I used to live in France, and that's where our daughter was born. Our son was born in this country, and right after he was born, he needed a medical procedure, like when he was 2 weeks old, which went well. He turned out great. We were happy about that. But it wiped out all of our savings and put us in a very difficult position. And the contrast between that and what we experienced when we were in France, we were working, we were paying taxes, we were paying into what they call Social Security, and it was just a completely different mindset. And that's what first got me, really interested in this. And the second thing that did is, I come from a union background, and my union represented a lot of part-time college teachers, and the system for anybody who's working part-time is just awful, obviously, and it's not only because they don't have decent health care, but it's also because they're kept part-time in order to avoid having to pay health care for them. And these are people who want to work full-time. The students need them to work full-time. They would like them. The school would like them. But because of this freaky system that we have, they are kept working, below what they should be doing. And we have so many people who are working at jobs also, on the contrary, that they don't really want to be working at, and they're not good at it. And we actually it would be good for them to move on. But they're legitimately scared because if they move on, they're going to lose their health care. The connection between people who are homeless, who are on the streets and don't want to be, is the connection between it and healthcare issues is, I think very, very profound.
Hold it up a little higher, please.
We have people who are, who have lost their homes because they've lost their health care and gone into medical bankruptcy. We have people who are on the streets because they have health issues, mental health issues, or they don't have access to addiction services that they need because they don't have health care. And once they're on the streets, of course, everything just becomes harder and harder and harder. Again, what we need is a system that cares for people from cradle to grave, right? And that prevents serious illnesses, and that will keep people working, that will keep them able to stay in their homes. It will give them the services that they need while they're, if they have supportive housing, just a number of ways in which Medicare for All is right at the heart of everything that we need to be doing with people.
Okay. So, what is Nurses for Single Payer Healthcare, and why are you involved in this movement?
Why am I involved in this movement? Well, because it's the right thing. I'm a retired registered nurse, 30 years in the operating room, and one thing I learned there is that we are, all of us, one banana peel away from total financial, emotional, and physical disaster. And maybe we can't do anything about the emotional, but we can certainly do something about the financial. And I think the thing that cemented it for me particularly was working in vascular surgery, which is to say diseases of the blood vessel, where I found myself doing amputations for people who had come into the emergency room with numb toes that had gone black, and they landed in my operating room, and the surgeon was having to take off those toes. And I'll spare you the subsequent drama, but what I also learned was that American diabetics have 3.5 times the amputation rate that European diabetics do. And there's something that we can do about this. Getting health care, high quality health care for everybody at a price we can afford is not pie in the sky stuff. It's done successfully in virtually every other, what we call civilized country in the world, and why not us?
The big question is always, how do we pay for it?
The truth is that the money is already there in this country. The one area where the United States leads the world in healthcare is the cost. We spend 50% more than the second most expensive countries, Norway and Switzerland, and they get better health care. They live longer, their infant and maternal mortality is lower. Why not us?
And the last question is, how do we create the political will to do so? You know, the money is there. How do we create that political will to do the right thing?
Unfortunately, we are up against a lot of money. There are people making millions and millions of dollars on healthcare, and I'm looking at you, CEO of Aetna and United Healthcare. You are pulling down over $60 million a year, which adds nothing to my healthcare. And you're not going to give this up easily. That's the opposition. And it's going to require us getting out and getting face to face with people and raising consciousness about where this money is going and what the alternatives are.
What about the whole value system? How do we create a culture of value of life that where healthcare is included as a human right value?
I think we need to re-emphasize the values and codes that we already have. We already have this notion that all persons are created equal. Why can't we have equal health care? It's certainly possible.
Thanks, David.
Hi.
Okay, so where are you from?
Chicago, Illinois.
And why did you come to the workshop?
Well, I live in a community. I live on Chicago West Side, and 17.9% of our black community is uninsured. And with a Medicare for all, the poverty income is $18,000. So a lot of them cannot afford the ACA. For Medicare for all, that 17.9% will become uninsured. With insurance, and that's why I'm here.